Hello and welcome to AD4 TV Radio News Update, coming to you live from Abuja, Nigeria's capital. I am Adirayo Senami. The federal government of Nigeria has finalized arrangements for the release of 60 out of 73 Nigerians imprisoned in Tanzania on different charges. The head of Media and Public Relations Unit, Nigerian Diaspora Commission, Abdulrahman Balogun, disclosed this on Wednesday, noting that the repatriation was made possible by the Nigerian ambassador to Tanzania. He further stated that most of the convicts were arrested for drug-related offences, while a few others were connected to immigration law violations. The Academic Staff Union of Universities, ASU, this Wednesday charged both the federal and state governments in Nigeria to learn from the coronavirus pandemic ravaging the entire world and invest in the nation's education sector, saying this will produce quality medical scientists who can respond scientifically to any health challenges that may threaten the country. ASU President Professor Biodun Ogunyemi said the nation's scientists can develop vaccines for the treatment of COVID-19 if the country's leaders show the political will to adequately empower the nation's biomedical and behavioral scientists. He emphasized that public education and public health are inseparable. Following the suspension of the 2020 Senior School Certificate Examination, the West African Examination Council (WAEC) in Nigeria will provide online portals to update candidates and the public on the rescheduling of the examination. In a statement signed by Demenos Ojujogu, WAEC's head of public affairs, the body called on candidates and other Nigerians to use the rich resources available on the portals for the latest news from the council. He explained that it's an interactive information sharing platform that allows the council to effectively engage candidates before, during, and after examinations. Candidates can log into the portal www.waecconnect.com with the login details sent to their email addresses during the registration process. The Nigeria Center for Disease Control (NCDC) on Wednesday reported 91 new cases of COVID-19 in Nigeria, 74 in Lagos, 5 in Katsina, 4 in Ogun, 2 in Delta, 2 in Edo, 1 each in Kwara, Oyo, Abuja, and Adamawa. As at 11:25 p.m. on the 22nd of April, there are 873 confirmed cases of COVID-19 in Nigeria, with 197 discharged and 28 deaths. 72 Nigerians awaiting evacuation in Guangzhou City, Guangdong Province of China, have tested positive for the coronavirus disease. The results of tests conducted on 56 Nigerians, which were released on Tuesday, indicates that the affected individuals are asymptomatic, raising concerns that they might have infected other people. 16 Nigerians had early tested positive to the virus, bringing the total number of infected persons to 72. Chinese authorities explained that 65 persons who had contact with those who tested positive are currently being traced. We'll take a short break now, but still ahead, a Nigerian technical university is set to produce ventilators for patients with severe symptoms of COVID-19. Later on, the World Health Organization sends caution over Madagascar's herbal cure for coronavirus. Stay with us. We'll be back shortly.
Nigeria's Center for Disease Control (NCDC) is the government organization with the responsibility to protect the health of all Nigerians. NCDC has a Connect Center with trained officers who can respond to any questions you have on infectious diseases, especially in emergency situations. You can reach the NCDC Connect Center by phone calls and other social media platforms. Voice calls are toll-free, and the trained officers will give you information or guidance on where to get immediate help. Call NCDC toll-free line on 0800-9700-0010. Website www.ncdc.gov.ng. NCDC. Let's work together to protect the health of Nigerians. This message is from the Federal Ministry of Health and the Nigeria Center for Disease Control, supported by University of Maryland, Nigeria program, with funding from U.S. Center for Disease Control and Prevention.
Welcome back. The Vice Chancellor of the Technical University, Ibadan, Oyo State, Nigeria, Professor Ayobami Salami, said the institution is on the verge of producing ventilators to support the Oyo State government in its fight against coronavirus. Professor Ayobami disclosed this while presenting renewable face masks produced by the institution to government officials at the Ministry of Health Secretariat, Ibadan. The Oyo State Commissioner for Health, Dr. Bashiru Bello, while receiving the face masks on behalf of the state government, commended the management team of the university for the support given to the Emergency Operations Center of COVID-19. And in world news, doctors in New York this Wednesday reported that the coronavirus appears to be causing sudden strokes in adults in their 30s and 40s who are not otherwise terribly ill. They said patients may be unwilling to call 911 because they've heard hospitals are overwhelmed by coronavirus cases. There is a growing evidence that COVID-19 infection can cause a blood clot in unusual ways, and a stroke will be an expected consequence of that. Dr. Rick Bright, the director of an office involved in developing coronavirus vaccines, says he was dismissed from his post in part because he resisted efforts to widen the availability of coronavirus treatment pushed by President Donald Trump. Dr. Rick Bright had led the Biomedical Advanced Research and Development Authority since 2016 until Tuesday when he was sent to a narrower position. He also announced that he will file a whistleblower complaint with the Department of Health and Human Services Inspector General. Jakarta, Indonesia's capital, has extended its lockdown as Muslims in the world's most populous Muslim nation prepare for a month of fasting. Jakarta's Governor Anies Baswedan, in a live-stream news conference late Wednesday, said the restrictions that were to end today will be extended to May 22nd. Meanwhile, the World Health Organization (WHO) says there is no proof of a cure for coronavirus after Madagascar's president launched a herbal coronavirus cure. The body cautioned that there is no shortcut to finding effective medication against coronavirus as international scientists and researchers race to find an effective treatment for the virus. The country's National Medical Academy also had doubt on the efficacy of the drug, saying it has the potential to damage people's health, as no scientific evidence has been established. The plant-based tonic, branded COVID Organics, is produced from the Artemisia plant, the source of an ingredient used in malaria treatment, and is to be given free to the most vulnerable in society. In response, the WHO says it does not recommend self-medication as prevention or cure for coronavirus. And that's it on 84 TV Radio News Update, coming to you live from Abuja. You can join the conversation on our social media platforms at 84 TV Radio on Facebook, Twitter, LinkedIn and Instagram. Please subscribe to our YouTube channel at 84 TV Radio. And thanks for watching. I am Adirayo Senami.